What is a blepharospasm day? Well, the best way to approach this, firstly, is really to just describe what it isn't. Okay, it's not an information day. Information days are great, but an information day is about one-way traffic. It's about doctors and professionals telling you about the condition that you have. But that's really not what we want the focus of today to be. Today is all about getting all of you involved with the process of learning about your disease. It's about, in fact, doctors, healthcare professionals, patients and their carers and relatives all getting together and sharing their understanding of the disease. And what's really, really critical here is to try and educate doctors. Although we deal with the disease on a daily basis, what we have a very poor understanding of is how it really affects you all in day-to-day life. And I know you all know what it feels like. I certainly do, in a very busy NHS clinic, where I have maybe 2 or 3 minutes to see a patient sometimes. I'll come and see a patient, we'll have a very brief discussion about how effective the last lot of injections were. And then, of course, the consultation ends before we can really drill down to what the problems are and how we can help you. We also want to try and get an idea of what the research priorities from all of you are. Now, doctors are always doing research. We want to try and make our understanding of disease better. We want to try and make the treatments better. But we don't really understand what you all want research to focus on. And there's a very famous example given by regarding rheumatoid arthritis. Now, with rheumatoid arthritis, for decades, all of the research was about pain and mobility. But when professionals actually asked patients what their main concern was, what really came up very high was fatigue. And it had just never occurred to any of the medical professionals or researchers that that might be a problem, because nobody had asked a patient. And we'll hear a lot more about that later. And of course, we want you to be involved in all of these different aspects, because to be involved in research and in your condition means that you will be able to influence it. You'll be able to influence the research, and you'll be able to influence how your disease is managed. And a really, really key outcome for this day as well is to give you all the opportunity to connect with each other. Most of my patients tell me that they have never met anybody else with blepharospasm, that they couldn't even conceive that other people could have it. And there are many thousands of patients around the UK who suffer from this terrible disease, and we really wanted to bring you together so that you could connect and know that you're not alone. I'm going to talk a little bit about the history of blepharospasm. This is a very famous painting by Bruegel the Younger, which many people think is the first ever representation of blepharospasm. Whether it is or it isn't, I don't know. But certainly in the 17th century, when this was painted, people with this condition were all thought to have some kind of psychiatric condition or of what we call functional disorder, which has no basis, no organic basis. Then it took this very eminent French neurologist, this is a man called Henri Mege, who was active in the late 19th century and early 20th century. And he described really clearly the nature of blepharospasm, how it tends to affect patients and how it can involve the mouth and other parts of the body as well. But from that time onwards, again, doctors tended to think of the disease as being psychological or all in the mind, or patients putting it on in some way. And it really took a very eminent neurologist called David Marsden, who many of you may have heard of. And he was probably the youngest ever professor of neurology in his early 30s, I believe, at King's College Hospital. And he was absolutely instrumental in forming our understanding of dystonias and classifying them. And it's really through the sheer weight of his intellectual stature and the quality of his research that blepharospasm was really put on the map as an organic disease. But this was not that long ago. This was probably in the 70s. And it is a new condition that we're really trying to get to grips with. But the point I'm making is that our understanding of blepharospasm has evolved and is continuing to evolve. And part of that process of evolution is having you all here and helping us to heighten and develop a more accurate understanding of the condition. Now, many of you will have seen this survey, okay? It's the Living with Blepharospasm survey, and we asked many of you to complete this before the day started. Now, we've had many responses, which is fantastic, and what we're going to do now, if it's okay, is we're going to just hand those out to everybody. We'll see some of our helpers in green t-shirts. They'll be handing out this survey. It will take you about 2 or 3 minutes to complete. But it's really, really important for us to have an accurate idea of who you all are and where you're coming from if we're really to understand what we're capturing. So perhaps during the talks in the morning and the afternoon, if you could just, there's a pen in your bags, if you could just put pen to paper and help us to finish the questionnaire, that would be fantastic. Now, we've had some of the surveys back, and I wanted to share some of the results. So I wanted to let you know who you all are and how the disease is affecting you all. Of the respondents we had, 8 were male and 24 were female, which tallies with the gender divide within the condition. We had most patients diagnosed, about 19 diagnosed more than 5 years ago, and about 29 diagnosed more than 15 years ago. So many of you here will have been suffering from this condition for a very long time indeed. The majority of you all took more than 2 years to get a diagnosis. I'm sure that's something that will resonate with many of you. And in terms of the severity of the condition, this is just a graph looking at how long it took to get diagnosed against the years since receiving diagnosis. And we can see most of you here took about 2 years or so to be diagnosed and have had it within 5 years. But many of you will have had the disease for up to 15 or 20, 22 years. And some of you, very sadly, have taken, one here, 30 years for a diagnosis, and somebody else here, 40 years to be diagnosed. And this is sadly not an uncommon scenario at all. In terms of how severely this has affected you, this is a bit of a complicated graph, but we asked you to fill in a standard blepharospasm severity score, which is not very patient-friendly, as you probably realised. But what we can see here is the majority of you have either moderate or severe difficulties with very common activities of daily living. So things like shopping, walking, reading, watching TV and driving. So we're looking at moderate and severe, and with some of you, these things are just not even possible. Okay, even things like walking. So in terms of today's programme, we're going to have a little session shortly starting where you're going to get a chance to meet expert clinicians in the field. They're each going to give a 5-minute presentation on an aspect of blepharospasm, and then there'll be a discussion for 25 minutes where you'll all have the opportunity to ask any question you wish, anything, okay? It's really rare to have this number of specialists within the room at one time, okay, but we're very lucky to have everybody here. We're then going to be introduced to our patient panel. I'm enormously grateful to our 4 patients who've agreed to take part in this panel and share their experiences of the disease. And to Ria Mattox, who has coordinated that, who you're going to get to meet, who's a really, really powerful advocate of patients and helping them to express their desires and their perspectives on disease. We're then going to have lunch, and you'll have a chance to look at our live wall. Some of you will have seen this already. The live wall is an interactive area where we're hoping to capture some of the aspects of the disease that you're going to be able to share with us. We then got a session looking at identifying priority research areas, because we want to know what you want our research to focus on. And then the final session will really be about getting involved, and we've got a range of fantastic speakers who are going to be talking this afternoon. We have the CEO of the Dystonia Society, we've got the Director of Funding for Fight for Sight, we have the Moorfields Eye Charity. So we're very, very excited to have that part of the talks. If any of you want to take this further and really want to get involved, really change the direction of your disease and the way it's being treated and managed and researched, then you will have an opportunity. Some very brief housekeeping rules. Firstly, we're not expecting any fire alarms today, any drills today. So in the event of the alarm going off, if you could head towards the exits at the back of the theatre, that would be fantastic. If you could turn off the mobile phones, that would be wonderful as well. There are roving microphones around the hallway. And if you look towards the back, you'll see lots of people with green T-shirts. There are junior doctors and medical students who are going to be running around. So please, if you have a question, wait for the microphone to arrive before you speak so that everybody can hear. And again, we've only got one big break today. There'll be a break at the end as well. So please come and see the live wall, interact with it. We've got touch and feel exhibits where you can play with some glasses. I'll show you a picture of that later. There are educational posters for you to learn more about aspects of the condition. There are charities here, Dystonia Society, Fight for Sight, the Moorfields Eye Charity. Please do go and visit them and see what they can do. And we also have the Light Catcher project, which is part of the UN Year of Light. It gives you the opportunity to make a little light catcher and express your perceptions on vision and light. Here we've got the glasses store, which a picture I've just taken, and these are really showcasing different kinds of filters and special glasses that we've had made up at Moorfields, which can help some people. So, and I know many of you will have heard of glasses. I do get asked about them quite a lot. So please go and have a look and see what you think. We'd love to hear what you think. And here's a picture of the live wall with our very glamorous young doctors here who are manning the wall. And please go and interact with the wall. And it's going to ask you about what your research priorities might be, okay? And what the worst things about the condition are. And we're going to bring this data together a bit later and present it to you later on in the day. Again, just really want to emphasise the survey, which you've all got now. And there's also a very short post-event questionnaire. And I'm going to bring this up again at the end of the day. And if you could complete that, that would be wonderful as well.